All right, we're live. It is almost 12 noon. I'm a little early. That's okay. So for all you viewers out there, my name is Dr. Kristina Tansavatdi. I'm a facial plastic surgeon, and I'm a board certified facial plastic surgeon. I work primarily on the face, and I wanted to talk to you about the fountain of youth. There's a procedure that I do that I think that doesn't get enough exposure, and I want to talk to you about that today because I have patients asking me all the time, how do I look younger? How do I stop the aging process? How do I get some years back? And let me tell you how. So when I say the fountain of youth, why do I talk about fat? Well, in our body, we have stem cells. And I know you have heard of stem cells. Everybody's heard of stem cells. We've used it for the knee for reconstruction. I just met with a patient today, and she was talking to me about her knee and how she's regained function. She was almost having to have surgery for that, and the stem cells saved her knee. She didn't have to have an operation. So what do stem cells do? I think you've heard a lot about stem cells. So stem cells can be used from another part of the body, and they can grow into pretty much any cell that's in your body to regenerate new tissue. However, there's different types of stem cells as well. So the stem cells that I'm suggesting that we're going to transfer when we do this procedure is we take stem cells that are surrounding the fat, and they can be used to, one, create more fat in the area that we've lost volume in our face. That's the biggest cause of aging, really more so than the laxity of the skin and the muscles that we tighten with a facelift. You can get an adequate facelift if you've got some good skin texture just by putting fat in the face to replace the volume that we lose as we age. So I wanted to give a little bit of a short picture of what happens as we age. And here is somebody in their 30s. They've got good volume. And as they age, they start to lose the fat in the cheeks, primarily in the cheeks and around the eyes. This is the first area that starts to age in our 40s. And then as we get into the 50s, you know, those jowls that everybody talks about, that area of looseness right around the jawline where our face looks really heavy down here and really lax here and hollow. Well, that's because all the fat is lost and we've got fat that's sagging down below. So what can we do with fat transfer that we can't do with a facelift? Well, with a facelift, it's kind of like, you think about it, you're pulling a tight cloth over a deflated balloon. Can you imagine that, where you're tightening something over a deflated balloon? No matter what you do for the tightening, it's still not going to look its best. So instead, we need to put the volume back to where we had with our youth, and then I can tighten the muscles over that. So more than anything else, volume, I think, is lost when we talk about aging, and that really is the creation for a fountain, the fountain of youth. So how is this different than injectables? So there's fillers out there that are available, has hyaluronic acid. You've heard of Juvederm, you've heard of Restylane Lift, you've heard of Voluma. Well, the difference with that is that these fillers are temporary and they go away. The beauty of fat is that it's using your own material, so it's safe, you're not going to have a reaction, and besides that, it will introduce new stem cells in the area, which has an effect also on the skin. We still don't understand why it does that, but the skin looks much more, has a glow to it after fat transfer. And in addition to that, you've got the volume, which also gives the face a glow. So that being said, how long does fat last? You're going to ask me, how does that compare to injectables? Well, it's not going to just bring you back by a couple years and then hold you there. So we're going to continue to age. So I can't tell you it's a permanent fix. Nothing's permanent, not even a facelift, not any of these procedures that are out there. But what it will do, it will give you back the volume that you need, and that volume will last you at least 5 to 10 years. I've gotten some results where it lasts about 10 years. So that's a good amount. And again, the earlier you get it done, the longer it lasts. Same thing with a facelift. The earlier you get it done, the longer the results will last. So getting fat done in your 40s, you may see this last until your 50s before you need to have it done again. Again, that's a nice procedure to do. And if you think about injecting with fillers every year that you have to do with maintenance, that's a couple $1,000s a year. And fat transfer is not more than $4,000, $5,000, depending on how many areas we have to do in the face. So if you think about what you're saving and the end result, I think you'll understand now why fat is a better option, because of both the stem cells that are injected as well as the price cost that you're saving. So again, thank you for listening to me. I hope you've learned something from today. And please, if you have questions, leave some comments below, as well as on our YouTube channel and Periscope. The other thing I would like to do is please visit us at our other social media channels. If you have some topics you want me to discuss, I'd love to address those comments. But as well, visit us at our website if you want to come in for a consultation so we can discuss more about how fat can help you in your face and help you looking younger longer. Okay? Well, thank you very much, and I will see you next Tuesday at noon.